your lived experience has allowed you to help and change your life. There's so many others who are going through the same situation, like in Cushing's. And so
Yes.
in a perverse way, it had to happen to you because that's the only way that others could have benefited from what you had gone through.
It's strange, really. I mean, just a month ago, I was invited to be on the medical committee for the Pituitary Foundation UK, and that's a great honour because it's endocrinologists and advanced nurses, and I don't know if I'll be the first radiographer to be on their advisory board, but it's a great honour, and it's a great chance for me to be more involved with the pituitary, give them back something that I could never have achieved, that PhD, without their support and without their patients. And patients are really very willing to take part in research studies. I found that quite recently at the University of St Andrews. Our local council, Fife Council, have a partnership with the School of Medicine at the University of St Andrews. And they have their patient public involvement group. The group is made up of people from different walks of life, from retired bankers and some academics, not many from healthcare. I think I'm probably the only one of two that's from a healthcare background. But they sit and they talk about their life's experiences of being a patient, and quite open about their lives. But we also have a role to play when it comes to staff and students putting in research ideas. So we look at the research ideas and we can be involved in that research. And quite recently I've gone on to an advisory board for premature babies, where there's a consultant neonatalist doctor in Fife who's looking at babies that are very, very small and don't have much of a human touch when they're in incubators, and how we can help by putting them onto the parent's skin.
So
It's
skin to skin, the
yes.
kangaroo.
And so she's been trying to get funding for that, very successful so far. And that's completely different, to what I've done. But it's interesting to see that people, staff and people themselves are putting forward research ideas. And this is part, I think, of this new innovative approach to universities, which I absolutely love. I love working with universities and young people, mature people coming along, ideas, some good, some not so good, but all, have a purpose. Usually. I think that's what I'm now really concentrating on. Two things is to make sure that we lobby the MSPs
pushing forward
to get education reform in Scotland, and that is challenging, but I think my colleague, who is Julie Rankin, she is our professional officer for the Society and College of Radiographers for Scotland. We work very, very closely together on this, but also I think on university projects, PhD supervision. I've just finished one at the University of Dundee, ultrasonographer who studied women's well-being with the condition uterine adenomyosis, which was really fascinating. It wasn't so far removed from the Cushing's, to be honest, because a lot of it was about quality of life.
Yeah.
Getting over to women when they have such severe problems, particularly when it takes a long time to diagnose some of these conditions. It can take years and years, and having to live with that, how they handle that, where there is help available to talk about it. So going back to what we were saying earlier about talking, I always like to think people can come and talk to me about their problems, their challenges, and I think most health professionals are like that. I'd like to think that they're open to talking about their emotions and how they feel about life in general. I think if we did more of that, we might not be losing so many people on early retirement and so on, losing people from the profession, which is very concerning at the moment.